Okay.
So tell me what bothers you about your skin.
I feel that I have a area on top that just doesn't look full and makes me look tired.
You feel like you look more tired.
Yes.
And have people been telling you that you look tired, or is it
Yes,
just the
they
way you?
have.
Okay, it's just the way you feel. And you feel like it's kind of through the central face area?
Yes.
Is there anything else that's bothering you at all?
Just the little fullness that it seems to kind of, right in here, kind of go in. And
So you feel like it's not full enough through
Right.
here. Do you feel like things are kind of sagging?
yes, I
if
do
you
feel
will?
like it's sagging.
Okay, and that's a very common complaint, and I can show you why people start to feel that way as we get older. There's a lot of changes that go on, not only with your skin, but also with your bone and your muscle and the fat beneath your skin that start to change the way your face looks. I think that this little diagram helps to explain it to patients. For instance, when you're younger, you have a really thick jaw and thick cheekbones, and also have thicker muscles. And as you get older, some of that bone gets resorbed or goes away and gets smaller, leaving indentations down by your chin here, reducing the size of your cheekbone, and also thinning out the muscles, which leaves some more hollowing down on the cheeks. And in addition, when you're younger, you have these 9 compartments of fat that help to support the skin, almost like a full balloon, and helps to make the skin nice and smooth on the sides. However, as we get older, those fat pads shrink and they descend, they go downwards. And so we're left with these hollows through the cheeks here. We're left with some hollowing by the jawline, especially because of that bone resorption as well. And then sometimes people get hollowing near the temples as well. All of those things combined start to make the skin look as if it's sagging because it's lost the support that was underneath it. So what we do, we can't replace your bone and we can't replace your muscle yet, but we can replace some of the volume that's lost from the fat loss. And one of the nice non-surgical ways to do this is with a product called Sculptra. Now, how Sculptra works is it is a medication that is mixed with sterile water and an anesthetic, and it's injected into the areas of volume loss in your face. The medication itself binds to the collagen fibers that are underneath the skin and causes them to grow more collagen so that you're left with new volume of collagen that's your own. The actual particles of the Sculptra go away, so they're not a permanent filler substance. It's just a stimulatory filler substance to create some new volume for you. It won't make you look like anybody else. It won't make you look abnormal or too full because it's a very gradual process. In fact, the treatment is usually done once every 4 weeks for either 3 or 4 treatment sessions. After that point, we usually don't have to do any more treatments for about 2.5 years. So this will be a very gradual change for your skin and for the volume of your face and make you look refreshed. And people won't think you had something done. They'll just think that you look more relaxed, less tired, and more youthful.
Great.
Do you have any questions at all?
I don't.
No? Okay, so we'll go ahead and do the treatment. What I'm going to let you know about the treatment is that today there's going to be water mixed into it. So you're going to have this beautiful volume that looks very youthful, but that's going to go away within the next 24 to 36 hours because it's simply the water that helps to distribute the particles around those collagen fibers. So the volume that you see today is not going to be there in 2 days from now. However, it's going to place those particles in the areas that we want them to be so that they can then grow new collagen for you. The anesthetic is going to leave the area a little numb for maybe an hour and a half, so if it feels funny, that's totally normal. It will go away. Afterwards, you might have a tiny bit of soreness for maybe a day or two. It won't stop you from doing any of your normal activities. You can exercise, you can put on makeup, you can do anything you normally would do. You just might feel like I had done something around the cheek area. The thing that we ask you to do after the treatment as well is to massage the areas 5 times a day for 5 minutes for 5 days. And what I mean by massage is just basically taking your fingers onto your cheeks in the area that's treated and making nice little smooth circles. This just also helps to make sure that the particles are evenly distributed in the skin.
Great.
Yeah. Do you have any questions at all?
No, I don't.
No? Okay, great. Then let's get started.